I'm Richa Parekh. I just started as junior faculty at Emory in the Myeloma and BMT division. And I trained actually at Karmanos and just graduated from fellowship recently under the mentorship of Dr. Jeff Zonder. And I would like to first of all thank Jenny, HealthTree, Dr. Zonder for having me join this excellent lineup of speakers and meet all of you wonderful people and just learn about the amazing, incredible initiatives of HealthTree Foundation and how patients can really help us as investigators to come to some really cool conclusions and perform some studies that would be otherwise really hard to conduct. So today I'm going to be talking about lifestyle factors in MGUS, smoldering multiple myeloma and myeloma. We heard a lot about all of the wonderful therapeutic advancements that have been done in myeloma, but unfortunately myeloma still remains incurable. And thus, I feel like there should be some focused efforts to reduce multiple myeloma occurrence, especially at the precursor stages. And myeloma is unique in that sense that we have these precursor stages of MCAS and smoldering where we can actually measure the myeloma markers in the blood and actually track the progression of MGUS or smoldering into multiple myeloma as compared to some other disease states like colon cancer, which do have a precursor condition, but there's not really a good way to measure or catch patients in this precursor condition and prevent progression into the final cancer. So although little is known about the etiology of myeloma, several metabolic risk factors such as obesity, diabetes, poor nutrition, and changes in the gut microbiome, many of which are modifiable, have been linked to the pathogenesis of multiple cancers, including myeloma. So today we know that at least 18% of all cancers and about 16% of deaths related to cancer in the US are related to excess body weight, physical inactivity, alcohol consumption, and or poor nutrition. But currently, due to lack of high-level evidence showing a survival benefit and considering the impact of active chemotherapy on the quality of life, patients that are diagnosed with MGUS and smoldering multiple myeloma are currently just being observed with a plan to defer treatment until progression to myeloma, and this is pretty standard practice. However, many of you that have been diagnosed with this precursor condition are really anxious given the impending risk of transformation to myeloma and are very interested in knowing some low-risk interventions that could help reduce this risk of progression to multiple myeloma. So I've worked very closely over the years with Dr. Urvi Shah, who many of you all probably know or have heard about. She's a myeloma provider at MSK and a kind of a pioneer researcher evaluating the role of lifestyle factors in myeloma. So this is a table from, oh, sorry, it's not going forward. All right. So this is a table from one of the review articles that we published together, wherein we provided a comprehensive summary of the impact of obesity on pathogenesis and outcomes in multiple myeloma. So while we were working on this review, we acknowledged that there was already a lot of research going on in this area. And this table here summarizes some of the large studies that assess the impact of BMI, or body mass index, an index that we commonly use to diagnose and classify obesity on the risk of development of MGUS and further on the risk of transformation of MGUS to multiple myeloma. And what we found is that overweight and obese individuals were at a greater risk of developing MGUS, and those that had a diagnosis of MGUS were almost twice as likely to progress with multiple myeloma. So the effect estimate that you see mentions number or says words like OR, which is the odds ratio, or HR, the hazard ratio, which basically implies like how much at a risk are you to progress from MGUS or into multiple myeloma, or what is your risk of developing MGUS? And you can see that those numbers are 1.8, 2.6, which means that you are twice as likely to basically develop this condition. And this table over here actually highlights some studies that are assessing the impact of obesity on myeloma development and also myeloma-related mortality. So our findings actually suggested that the influence of BMI in plasma cell disorders may actually be stage dependent. So in normal individuals, an elevated BMI is associated with an increased risk of development of myeloma and increased myeloma-related mortality. But we also found that at the time of myeloma diagnosis, transplant or relapse, excess BMI actually was shown to have a protective effect or an improved effect on survival, somewhat implying that patients with a higher BMI were able to tolerate the therapies better maybe, or they had less disease-related weight loss, or cachexia as we call it, and that's why they went through those therapies and did better with those therapies. So a lot needs to be understood better or clarified, and that's what kind of emphasizes the need for additional studies that are looking at the influence of weight and body composition throughout the disease trajectory. And obesity is particularly interesting because it can be prevented or modified. So prospective trials looking at lifestyle interventions promoting weight loss or improved body composition are on their way to see if altering this exposure is going to impact the diagnosis of myeloma. And this figure, again, is from one of the review articles that we published, and it summarizes various mechanisms by which obesity is linked to myelomagenesis. And so it is associated with increased fat in the bone marrow that is thought to contribute to myelomagenesis by increased levels of leptin, inflammatory cytokines like interleukin-6 and TNF-alpha, increased insulin and IGF levels, and decreased levels of adiponectin and resistin. We do need further preclinical studies to exactly characterize these complex mechanisms by which obesity affects myelomagenesis, and that can also probably help us identify potential targets for treatment. Sorry, I guess I'm not coordinating this well. So yeah, this is the figure that I was talking about. And here we have a figure that basically outlines that multiple myeloma is classified now as one of the 14 cancers that have been linked to body fatness. And these are some of the other cancers that have been associated and officially classified as obesity-related cancers. Now talking about diabetes and multiple myeloma, so I'll mention this population-based study that was conducted in Israel, had about 400,000 patients with diabetes, and this study did actually show that, that there was an increased risk in overall cancer, including multiple myeloma. So we had about like 1,000 myeloma cases in this study after a diagnosis of diabetes. And the highest risk was within the first year of diabetes diagnosis. And again, the hazard ratio of 7 means about that you were 7 times at a higher risk of getting a diagnosis of multiple myeloma after having been diagnosed with diabetes, and about like a 6-time higher risk for men. And this risk gradually decreased over time, but still persisted up to the following 11 years. And here's another study actually that was done in Canada with about 3 million individuals, and that looked at broadly the risk for all hematologic malignancies, including multiple myeloma, and it did show a higher risk for multiple myeloma in individuals that had diabetes. And most of these findings were most pronounced actually amongst women and those in age less than 65 years of age. And then now impact on survival related to diabetes. So this was a 2-center study conducted at MSK and Mount Sinai by Dr. Shah's team. Had about 5,000 patients, out of which 15% patients had diabetes. What this study found was that diabetes was actually more prevalent in black patients, about 25% incidence as compared to white patients, where we saw an incidence of about 12%. And a decreased overall survival was actually reported in patients with diabetes, particularly white patients. And so moving on to diet and multiple myeloma. So this was actually an online survey conducted by Dr. Shah and her team in 421 patients with plasma cell disorders. And what we learned was that 82% of you all had questions about their diet after their diagnosis, and only 57% of you all reported that their dietary questions were addressed, or they reported that your dietary questions were not addressed by their oncologist. So this kind of outlines a deficit in us as oncologists, that we are probably not addressing your questions right, and that may have something to do with the fact that not all of us are up to date about what the dietary guidelines are or what the evident data is in this field, particularly related to multiple myeloma or other types of cancers. And also, amongst all the patients that reported receiving dietary guidance from their oncologist, 94% attempted to follow it. This actually tells us that as oncologists, we have such a huge role to influence our patients, and that patients will be willing to follow our advice if we did address it, in fact, with good backup from science and data. So here is a few studies that we have looked at, and the one on the left actually is the EPIC Oxford and Oxford vegetarian cohort. That was a study conducted in Britain, which had about 61,000 people and 65 cases of myeloma, and it did show that vegetarians and vegans had a 77% lower risk to develop multiple myeloma as compared to meat eaters. The study on the right was conducted in the Nurses' Health Study and Health Professionals Follow-Up Study cohort, had about 116,000 participants and close to 500 myeloma cases. And that showed that a particular dietary pattern called the empiric dietary inflammatory pattern was associated with a 16% increased myeloma risk in men. And then this was the study on the bottom left is a study that I was actually a part of with Dr. Shah's team, and we evaluated the association between pre-diagnosis dietary patterns and multiple myeloma risk in the NIH AARP Diet and Health Study cohort, which was a large population-based study that had about 500,000 people who completed a food frequency questionnaire back in 1995, 1996, and they were followed for about 15 years. So we basically calculated 4 dietary indices that have been previously published and that are the HEI 2015 or the Healthy Eating Index 2015, HDS, which is the Healthy Diet Score, AMED, which is the Alternate Mediterranean Diet, and HPDI, which is the Healthful Plant-Based Diet Index, to assess diet quality. These were calculated using previously defined methods, and after exclusions in our study, we had about 400,000 participants, out of which we had 1,366 myeloma cases. So till date, as you can see, as compared to the other studies, we did have like more number of myeloma cases, which kind of strengthens the findings of our study. And we found that there was a statistically significant association between HPDI, so the Healthful Plant-Based Dietary Index score, and slightly reduced multiple myeloma risk for the highest quartile versus the lowest quartile of consumption. And all of the other scores were not actually associated with multiple myeloma. And then the study on the right was published by Dr. Joseph, and it shows that basically increased consumption of Coke or soda, soft drinks, or any beverages that are sugar sweetened actually had a higher risk of multiple myeloma. So studies like this will help us as oncologists to guide our patients in making healthy, informed dietary choices. And this is another review article that I had co-authored with Dr. Shah, and where we provide like a detailed review of all the evidence there is on diet and microbiome factors in the pathogenesis of multiple myeloma and their impact on outcomes. And I will give you like a few points that need to be highlighted in terms of the individual dietary components, and that is that consumption of fruits, so citrus fruits like oranges or things that contain vitamin C that you would think about, they were shown to have a reduced risk for myeloma. Consumption of vegetables like cruciferous vegetables, so cabbage, cauliflower, broccoli, and Brussels sprouts, so anything that has a cross at its bottom. Think about that like as a cruciferous vegetable. So those were shown to be associated with a reduced risk for myeloma. Consumption of whole grains. Now this is very important. So a lot of the times the grains that we consume have actually been refined and processed, and that actually leads to in the processing, in the process of like the refinement, it actually gets rid of some of the fiber content or the nutrient value of the grains, and so consumption of whole grains actually was associated with reduced risk for myeloma. And again, seafood was shown to be, in all of the studies that we looked at, was shown to be protective. And on the other hand, high consumption of red meat and dairy products was actually associated with a slightly increased risk for multiple myeloma. And here this further gives us some more information about the various supplements that people have questions about, and curcumin is a big one, I know, and we do have some data from studies, but I have to tell you, like, these are really small studies, but we do have some prospective studies that are looking at it in a more balanced fashion. And mind you, the dose of curcumin that was looked at in these studies was actually like 4 to 8 grams. That's a lot higher than what I use as an Indian in turmeric in my cooking. So it's not just a pinch of turmeric, this is a big dose of curcumin, which is the active ingredient in turmeric, and there is some studies that are looking at this in a prospective fashion. And then vitamin D deficiency actually was, there was a high incidence of vitamin D deficiency observed amongst myeloma patients, and was found to impact the clinical presentation, myeloma activity, bone-related events, and outcomes in myeloma patients. Here is just a neat figure that kind of compiles all of this information about diet and its impact on the gut microbiome. This is a very recent topic of interest where we are able to study the gut microbiome composition with the availability of better techniques, next generation sequencing approaches, and like shotgun metagenomics to basically identify the bacteria that line our gut and also understand what their function is in our gut. And this figure here shows that a beneficial diet, which consists of a regular consumption of a variety of fruits, vegetables, whole grains, fiber, beans, legumes, and limiting the intake of animal products has an impact on the gut microbiome by improving its composition and its diversity. By increasing short-chain fatty acid producers and decreasing nitrogen-producing bacteria and bile-tolerant bacteria. So basically, we as humans are more bacterial cells as compared to human cells. So in our gut, we have almost, or in our bodies, we have like 38 trillion bacterial cells, and we have about 30 trillion human cells. So we actually have more microbial cells than we have human cells. And so this ought to influence our health or disease states. And so that's made all of the researchers very excited about looking at the gut microbiome. And the biggest modulator of gut microbiome, we have to say, is going to be diet. A healthy diet can modulate the metabolome or the immune microenvironment and influence outcomes related to progression and survival in patients with myeloma. And also it has been associated with reduced toxicity and comorbidities that are associated with some of the treatments that our myeloma patients get. And so these are just a few slides about ongoing prospective intervention trials led by Dr. Shah at MSK. And I thought it would be helpful to just bring it to your notice that there are trials like this that are going on. So Nutrivention is a prospective dietary intervention or nutritional intervention trial that had a small number of patients, like 20 patients, led by Dr. Shah, and where the team investigated a high-fiber, plant-based dietary intervention in patients with MGUS and smoldering myeloma and an elevated BMI, so patients that were overweight and obese. So this study did include high-fiber, plant-based diet, frozen meals that were provided to patients, 6 meals for lunch and 6 for dinner, and detailed recommendations for preparation of breakfast and snacks for about 12 weeks, which was 3 months. So these meals were all high in fiber, vegetables, plant-based fats, and whole grains with a low glycemic index and minimal processing. And this was provided to patients through collaboration with a plant-based food delivery system. And patients also received 6 months of nutritional counseling, and they were followed up to 1 year. So nutrition has currently completed enrollment, and some of the prelim results here that I have shared with Dr. Shah's permission, and this was presented recently at the IMS meeting and also ASH meetings, and the manuscript is currently under review. But what this showed was the median age for this cohort was about 62 years with a range of 40 to 79, which tells us that even patients in their 70s were actually interested in changing their dietary habits. 43% of the patients that were actually enrolled to this study belong to minority races, which is much higher than the 15 to 20% enrollment that we saw earlier today in all of these other clinical trials. The blue bars over here in the second figure actually show patients' baseline compliance to a high-fiber plant-based diet, and you can see that it's really poor, a median of 20%, which during this intervention increased to about 92% as at week 12 and also at week 24. And then you can see that after the actual 3-month intervention was completed, the rates did drop off a little bit, but it still stayed much higher than their baseline at 73% at 6 months. Which basically implies that because of the nutritional counseling and the behavioral changes that were induced by this intervention, people were eating more carbohydrates that were complex carbohydrates in the form of whole grains and more fruits and vegetables. And so it was more of like a habit-changing intervention. And so even after the intervention completed, people were still following that diet and had a higher adherence to that diet. And their fiber intake increased from a median of 18 grams to about 30 grams, which is where it should be. But we do, as Americans, we do a poor job of eating that much fiber in our diet. And then this next figure here tells us that patients really reported that they felt an improvement in their symptoms. We received like 15 responses, and you can see that all of the patients reported that the intervention was easy to follow. 4 of them reported that they were able to stop medications that were needed for diabetes control or so, saving them some money for that. And they were able to attain a healthy weight and maintain that weight and have more energy, feel good, no bloating. So those were all good things. And on the science side, we collected a lot of markers from the blood and also stool collection. And what the study did meet its primary endpoint, which was just adherence and feasibility and BMI reduction. So it did meet all of those endpoints. And we saw that actually the leptin-adiponectin ratio, which is a marker of insulin resistance, was a higher ratio implies higher insulin resistance, and we saw that there was actually a reduction in this insulin resistance ratio. And when the stool microbiome was evaluated, we saw that there was an improvement in the microbiome profile, which basically led to increase in the alpha and beta diversity and composition of the gut microbiome, and increase in stool butyrate concentrations after the intervention. And we also saw some improvement in the immune profile, which relates to the specific types of T cells that are seen in the blood, and so that was also a favorable outcome. And this is very early data, and it's only 2 patients that actually had an improvement in their M-spike trajectory after doing this intervention. These 2 patients had lost more than 10% weight, so there was a greater than 10% reduction in their BMI. And when we saw that when this much weight was lost, there was a slowing in their M protein trajectory. And this is another like nutrition trial which is currently enrolling, and this looks at smoldering myeloma patients, and the endpoints are basically to check for the short chain fatty acids or butyrate producing bacteria. And the study basically includes about 100 smoldering myeloma patients. It's only a 2-week randomized study to study the effects of like a high fiber plant-based diet versus probiotics versus omega-3 fatty acids and curcumin. So there are 4 arms with 25 patients in each of the arms. And we basically, anybody that has smoldering myeloma would be eligible for this study. And this is actually available to register for through the HealthTree Foundation. And you can be anywhere. It's conducted primarily at MSK where Dr. Shah is, but you don't have to be in MSK, and you don't have to have like an in-person visit at MSK. They have research dietitians that can actually call you and have telehealth appointments. And so this is something, if you are interested in, that you can look it up on HealthTree and enroll for it. And then the third nutrition trial is also open, and that one has about 150 patients with MGUS and smoldering, and it's currently open at 2 sites, at MSK and also at Emory. Patients need to come in for 6 visits over a year. And this one's also looking at dietary supplements versus placebo versus a high fiber plant-based diet. And so with that, I would like to say that this is a very exciting field, and we would love to study, along with all of these nutrition trials that are being done, we would love to study the influence of diet and gut microbiome on immune therapy responses. and see if there is a way we can use dietary interventions as an adjunct to CAR T-cell therapy or bispecific antibodies to improve the responses or even tolerability. There are some bispecific antibodies that have been associated, talquetamab has been associated with a high incidence of dysgeusia or taste disturbances and weight loss, and to see if any of our dietary interventions could be an adjunct to improving responses and tolerability in myeloma. And of course, we still don't know the role of diet in microbiome and amyloidosis, so that's really a big space that needs to be looked at. And of course, for patients who have gut involvement with amyloidosis, we do believe that there is a role that microbiome is playing, but we just don't know about it yet, and so that's an important area for future research. And then, of course, how the gut microbiome plays a role in development of drug resistance. With that, I would like to conclude and open the floor for questions. These are all my acknowledgements. I would like to thank my team at Emory, Dr. Shah's team at MSK, my mentors, Dr. Zonder and the team at Karmanos, and I did spend some time at the Myeloma Center at Little Rock for a few years as a hospitalist, so I'd like to thank all of my mentors, and then of course HealthTree and Jenny for having me here today. And with that, I would like to take some questions, if we have some time.
Dr. Parekh, we are so happy to have you. And this is not the first time that we've partnered on nutrition with Dr. Shah. So we've done considerable amount, and she has a food frequency questionnaire also inside of HealthTree. It's very long, but that helps her understand her research and yours. So I'm thrilled that you are partnering with us together.
Yes.
So it's so awesome. And please, if you know of any smoldering myeloma patients who want to join the Nutrivention trial, please do that. Okay, what kind of questions might you have?
Hi, my name is Mary Miller, and what is your take on sugar feeds cancer?
All right, so this is a very common question that comes up in clinic, and a lot of patients want to know about this. And so I think the way to look at it is sugar can come in many forms, and sugar is basically carbohydrates. And so it depends upon, is it simple sugar or simple carbohydrates or complex carbohydrates? And the difference is that like added sugars, which are basically our sugar sweetened beverages, so Coke or soft drinks or candy, ice cream, donuts, muffins, anything that has added sugar, they are considered to be high glycemic index foods. So basically they will, when you take those food items, they will they have simple added sugar that gets absorbed really quickly and leads to this big peak of glucose in the blood sugar when we check it, and that also leads to further release of insulin in high amounts. And so the general consensus and the dietary guidelines say to move away or limit the consumption of these substances that have artificially added sugar. Now on the other side, we have fruits that have naturally occurring sugars like sucrose, fructose, and you may say that that's also sugar and that might be bad sugar, but not really, because it is the casing that it's wrapped up in. Like the fruits have a lot of vitamins, other nutrients, fiber, and that makes it overall a healthier substance to eat or consume as compared to a donut. And so looking at the kind of sugar that you're incorporating in your diet is more important than having no sugar at all in your diet. So I would say consuming whole grains, which have complex carbohydrates, are not going to cause that big spike of glucose that you see when you have like a canned juice, for example, or caramel latte, for example. So they're not going to give that kind of a peak. And so try and avoid things that have added sugar. Get in the practice of looking at labels for anything that you're about to eat, and see how much added sugar they have. Usually we are supposed to have, so the dietary guidelines recommend that women have about 6 teaspoons of sugar in a day and men can have about 9 teaspoons, and on an average Americans have about 17 teaspoons of sugar in their diet. So we do have some work to do over there, and just getting aware, getting to know or getting educated about these things, and being mindful and intentional about what you eat is probably going to make a difference.
Okay, what else? What other questions?
I'd like your thoughts on organic versus non-organic.
So yes, so again, another very important question, frequently asked question by patients. So what does organic food mean? It basically refers to foods that have a low incidence of, or plant-based foods that are grown without the use of herbicides or pesticides or insecticides, or animal-based foods that are basically derived from animals that have not been fed with hormones or that have been grass-fed. So those are the things. And even with processing and transporting, there has been minimal use of chemicals or additional like solvents and things like that. So that's what organic food means. Now, the data that we have so far has not actually shown that organic food is associated with a reduced risk of cancer so far from what the data we have. And also we know that it's not that the nutrient value of organic foods is more than non-organic foods, it's just the presence or absence of these harmful substances, if you will. So it's not like a non-organic food does not have the same amount of nutrient value, but it's just that the organic food might have less of the pesticides or the insecticides. So an easy way to look at that is if organic foods are expensive, and so I would say instead of focusing on trying to buy an expensive food and in the process not being able to afford fruits or vegetables and missing out on that nutrient value altogether, maybe buy non-organic fruits and vegetables and wash them to make sure that the pesticides and insecticides are removed. Yeah.
One other question. About, have you done any research on fasting and also some of these therapies where they're using high doses of vitamin C intravenously and some of these alternative therapies? Do you know anything about these?
So fasting, there is a lot of, I know there is a lot of interest in keto diet or intermittent fasting diets and things like that. And actually, I think Dr. Shah had done a study on keto diet versus plant-based diet, and they actually found that plant-based diets were thought to be a little better than keto diets. And the reasoning might be, again, not all carbs are bad. It's just the kind of carbs. Keto diet specifies that you have like a very low amount of carbohydrates, but in the process you kind of miss out on the high fiber and other nutrient values that carbs may afford. And so in fact, plant-based diets or complex carbohydrates, whole grains, they were actually thought to be better than ketogenic diets. Oh, the vitamin C. I am not very familiar with the high dose vitamin C. I know about some data there is on vitamin C supplements, and those may have like a protective effect on the on cancer risk, but I would still encourage consuming vitamin C through natural sources like fruits or lemon or anything like the citrus fruits is probably going to be safer and better than trying to do like high dose IV. I'm not very, honestly, I'm not very familiar with that IV therapy.
I just wanted to add one point for the high dose IV vitamin C. I'm at least aware of some data suggesting that some of these approaches can interfere with some of our myeloma treatments.
Yes,
so I would
that's
strongly caution against, considering like high dose, IV vitamin C, especially if you're working with drugs like bortezomib, for example, is the classic example. But I don't think we know how a lot of these vitamin supplements necessarily work, either helpful or harmful. So I would just, in general, exercise some caution and try to work with your providers to get good quality information about complementary and alternative medicine. Memorial Sloan Kettering has a really good website looking at, general questions about supplements that you can like search. That's, I think, a good quality source of information, but I would probably work with your treating docs and their pharmacists about like particular questions as it relates to those. So sorry to chime in.
Right. No, absolutely. Thank you so much. Yes, that's right. There has been some studies that have been reported with a impact on the efficacy of bortezomib with vitamin C. Absolutely, yes. Mm-hmm.
I'm a fan of Dr. Shah. I had been experimenting on the 1st and the 15th of the month with a 36-hour fast because after 18 hours I learned from Dr. Jamnetta, a cardiac surgeon, that autophagy occurs. So I was going for the cell kill. So when I joined Dr. Shah, she mentioned a 5-day, 500-calorie fasting mimicking diet. Are you familiar with how that would work?
So actually, I am not very familiar, honestly, with that diet, but I do know that actually trying to eat within the normal times, like as compared to having prolonged fasting times like 18 hours and only 6 hours where you can actually eat. I think as compared to that, having a more like what do you say, like the normal circadian time of eating, so 8 hours of during the daytime. So normally, like as we would eat during the daytime and not eat during the nighttime, I think that's all right. But going too long without eating has shown actually to have some detrimental effects. But I'm not very familiar with the exact, the 5-day fasting mimicking diet that you talked about, sorry. Okay, okay.
I just want to share something. I have smoldering myeloma. It's been smoldering for 4 years now. My markers are going down. My doctors are going, I don't know what you're doing, but keep doing it. I intermittent fast every day, a 16-hour window. I am plant-based because of Dr. Shah. I'm 74 years young, and I have never felt better. I exercise every single day, and I'm on a roll, and I'm going to be a poster child for you, mark my word.
That's awesome, thank you. And yes, that is another like important point that I would like to emphasize. I think physical activity is also really important, and the dietary, I mean, all the like the guidelines do suggest about 150 minutes to 300 minutes of moderately strenuous activity. So that's about 30 minutes of walking or moderate exercise 5 days a week, and that is kind of recommended by the guidelines. And then having a healthy sleep pattern is important, and at least getting 7 hours of sleep is important. And so I think, and again, I think diet, the other important thing to remember is also the stage of disease that you are in. So if you've been newly diagnosed with myeloma, struggling with a lot of inflammation, are just about to start therapy, you don't have an appetite, and you've lost a lot of weight, and there's only so many things that you like eating, I wouldn't try to make any drastic changes to your diet at that time, because we do want you to take calories, and at that time, like, you would rather just try and catch up some of the weight than trying to make a drastic change in your diet from animal-based to plant-based. So I would say small, gradual changes in your habit is going to be more sustainable than trying to do a major change in your dietary pattern overnight. And be mindful of the disease stage that you are in too. And if you're already struggling with a lot of other things, I wouldn't try to impose a strict diet restriction at that time.
Okay, we'll do 2 more questions. One here, and then we'll break for lunch.
All right.
Okay, what do you think about your feelings on using drugs like Wegovy for weight loss?
Very interesting topic, and actually Dr. Shah and I have been actually thinking about that, about seeing if the GLP-1 agonists have any effect on slowing the trajectory of progression. So this would be ideal to look at in patients that have smoldering myeloma to see if the effect on BMI can help slow their trajectory. So it's in progress. Hopefully we can have a study that is looking at that soon, and we'll know more information. But yeah, we do postulate that because these drugs have shown, like I think like semaglutide and tirzepatide have shown about, on an average, 80-85% of the patients that were on those studies lost 15% of their weight on an average, and that's a huge amount. And we saw in Dr. Shah's study that even with patients that lost 10% of their weight or 10% reduction in BMI had somewhat of a slowing of their M protein trajectory. It was a very small number. It's only 2 patient data that we had, so it's not substantial, but it's promising nevertheless. And so if these drugs can cause like about 15% average weight loss in patients, we would definitely like to see what their impact is on the M protein trajectory or progression into myeloma. But again, there is no scientific data at this point, but it is an important topic that we're considering for future research.
Okay, last question.
appropriate for lunch here. For us multiple myeloma patients, as my limited understanding, it's all about cellular inflammation and staying away from that. What's the 3 things we should not put in our mouths besides soda?
Okay, so I think sugar is a big one, I would say. Like added sugars, again, not like the sugars that are derived from fruits or vegetables. I think the other thing is going to be high fiber. So routinely, Americans take in about 10 to 15 grams of fiber, which is much less than what is recommended, which is about 25 to 38 or 25 to 40 grams of fiber. So incorporating high fiber foods which you can get from beans, or legumes, fruits, whole grains. So incorporating all of these things in your diet, I think, would be number 2. And then limiting consumption of red meat or processed foods, processed meats, and processed foods in general. I would not say leave it altogether. Dr. Saunders is giving me some bad head nods here, but limiting consumption, I would say, of red meats is what has been proposed in dietary guidelines. So there is conflicting data on alcohol in myeloma as such. There has been overall, we know that alcohol consumption is associated with an increased cancer risk, and that's what the guidelines mention, that you should not have any alcohol at all. But if you were to choose to have alcohol, it should not be like more than 1 drink per day in women, more than 2 drinks per day in men. So it shouldn't be more than that. In myeloma, actually, there were a few studies that were done that actually showed conflicting evidence, and we don't know exactly what happens, but they actually showed a protective effect of alcohol, again, when taken in moderation. And I think that has to do with the fact that alcohol does have resveratrol and some antioxidants, and it can have, when taken in small amounts, it can actually have a beneficial effect on the immune profile. But again, I'm not going to endorse anybody to drink alcohol over here, but anything in moderation, but not more than 1 to 2 drinks, I would say.
Okay, let's give Dr. Parekh a hand. She's amazing.
Thank you so much.